It takes more than just an apple a day to keep the doctor away. Shape up with Body and Soul.
938 Live.
Hello and welcome to another edition of Body and Soul, and you're with me, Debra De Souza. Well, today we're going to take a look at a very common problem that affects many of us, and some of us perhaps have been trying different ways to get rid of this problem, and that is bad breath, otherwise known as halitosis. Now, it's a social embarrassment, we know, and that's why we thought we want to take a look at it today and help you so that, you don't necessarily have to go out to the dentist, for example, if you are so embarrassed to talk about it. But just by listening to this program, perhaps you can learn something and some ways in which you can actually promote good breath. Now, today with us, we are going to be speaking with Dr. Dr Speiser, who is a dentist, and he specializes also in bad breath. He's from the Australian Breath Clinic from Sydney, Australia. Now, if you have a question, it's a great time, an opportunity to ask him on 669-11938, because he has certainly made a discovery about a certain thing that can actually help you to have good breath, and it's all got to do, of course, with bacteria. We know that bacteria is behind the cause of our bad breath. So we'll take a look at this. I'd like to welcome you, Dr. Speiser, for being with us today on our show.
Welcome, Deborah. Thanks very much.
Now, let's start off first. Many people, when they think about bad breath, they've been told that it comes from the stomach.
That's
they
correct,
think it comes from compounds from the stomach. But, you were saying that 90% of people who suffer from bad breath actually suffer from it because it comes from around their mouth. Tell us what's happening in the mouth causing this bad bacteria, or this bad breath, rather.
Okay. Well, look, everyone seems to understand that bad breath is a result of bacteria. And actually what's happening is bacteria that live in the mouth make waste products. And it's these waste products that actually cause the smells of bad breath. The misunderstanding is that bacteria that live in the stomach also have the same metabolic pathways. So the types of smells that stomach gases can give off can be very similar to mouth gases. But studies show that it's basically it's a mouth problem 90% of the time.
Okay, so compounds that come up from waste products from the stomach, as you say, do they travel as far up as into your mouth?
Well, if you have heartburn, but everyone, not to be too gross, everyone has smelt, say, stomach burps as compared to bad breath, and bad breath does have more of a distinctive odour, so you can tell the difference. Not only that, you do have a sort of a border across the stomach that stops you from letting stomach gases up unless you burp. So in general, stomach gases don't tend to rise all the way up to the mouth unless there is an initial problem there.
Okay, tell us about this bad bacteria then that lives in our mouth.
Well, they're actually not bad bacteria. Their job is to take proteins that we put in our mouths to break them down into compounds that we can use for energy, and the waste product are sulfur compounds. The issue with these particular bacteria is that they're more opportunistic than some of the bacteria in the mouth. So if we change the environment of the mouth, they can grow more quickly, so we end up with a lot more of these bacteria than we need.
Okay, what is this bad bacteria then, and also the good bacteria? Because we all have two types, yeah?
Yeah, we have bacteria that live with oxygen and bacteria that live without oxygen. The ones that live with oxygen are more fragile, don't tend to make the smells that cause bad breath. The non-oxygen bacteria are the ones that break down proteins and make these bacteria, these bad breath smells. They're a lot more hardy. So when you take, say, a mouthwash that is very strong, or even if you take antibiotics, you never kill all of them. You might kill, say, 90%, allowing 10% to survive. But you've killed off a lot of the good bacteria, then that 10% can grow a lot quicker in numbers.
Okay. And do they reproduce quickly as well? As you say, they grow in numbers?
Within hours.
Okay. Yeah. So we can never really get rid of it completely just by using
normal... Well, you don't want to. You don't want to, because these are...
They're actually quite good for us in
That's
some
right.
way.
Their job is to break down proteins to give you energy.
But it's only like if you actually end up with having more bad bacteria than good bacteria, then
That's
the problem
right. You've got an imbalance there.
Mm-hmm. So you need to really set in a good balance. Now, in our mouth itself, where does this bacteria tend to come mainly from? Which part of the mouth?
Well, bacteria actually live in coatings. They don't sort of float freely around the mouth. And what you find is, for example, you have a coating on your teeth called plaque. You get a coating on your tongue that builds up every day. and you might get coatings in your throat or your nose depending on whether you have nasal problems or any other issues. Now, the coatings, once they are more than 24 hours old, so if they're not cleaned off every day, they become a good nutrient source for the bacteria. So the bacteria then will develop into the coating, and from there they have their own little economic life going away, and they're very hard to remove once they're in those coatings.
Right, so when we look at our tongue and we might see a whitish surface on the tongue, is that the coating you're talking about?
That's the coating, but again, let's take, for example, someone that has nasal problems. They will always have a coating on their tongue. That doesn't mean they have a problem, right? So people try to see it as black and white. Coating equals problem, which is not necessarily true. What it is a coating that is more than 24 hours old equals a problem.
Okay.
So if you clean the coating every day, you don't tend to have the issues.
Right, but people with nasal problems do tend, or people who suffer from sinus, they tend to complain that they have bad breath, or that they can, have a bad smell whenever they breathe.
That's because basically the coating is building up in their throat. It's past the gag reflex. They're not able to get to that coating and clean it every day. So that's why nasal people tend to have an ongoing issue. The only thing nasal people really can do is they can change their lifestyle so that they have a thinner type of nasal secretion so that it doesn't collect as easily, and they can use saline flushes to flush through their nose and to flush mucus away.
Do we have more coating at the back of our throat than on our tongue surface?
The tongue actually extends a long way down the throat.
Okay, so and does it tend to develop more at the back of the tongue? That's right.
It's always the back of the tongue and the further back, yes.
Right, and those places are very hard to reach, don't you think? Or?
Well, that's right. Once you're past the gag reflex, which is only getting to halfway, down the throat, yes, there's a lot of bacteria build up there.
Okay. Now, what about gum disease? Because a lot of people have bad breath because of gum disease as well. So has that got to do with the same bacteria we're talking about?
It's yes and no. Basically, gum disease changes the type of bacteria that are living in the mouth. First of all, they've got their own microcosm living under the gums, and that's why that coating there is a food source, and that's why you need to go to a gum specialist to have the gums cleaned out if you have gum disease. But from the type of bacteria, the toxins they're giving off, they just help to change the balance of the bacteria in the mouth. So gum disease people tend to have a harder bacteria in their mouth.
What about foods that give off sulfur compounds, garlic and onions? Is that different again?
Different again. You put a sulfur compound directly into your mouth, then in reality, after a period of time, that sulfur compound will clear out. So you'll have bad breath for the time the sulfur compound is in there. And by foods that have sulfur compounds, obviously the garlics and the onions, but any vegetable that you cook up that smells. So when you look at cabbages and Brussels sprouts, all those things that are really good for you, they smell when you cook them up because they've got sulfur in them. So basically, bacteria, if you change the bacteria balance, you've got an ongoing problem. If you have foods that have smells to them, you have a problem while that sulfur is in your mouth, but that will dissipate over time.
Okay, so that becomes like transient. And
that's
but
correct.
The other problem is more chronic, yeah? People live with chronic bad breath.
Correct.
Now, let's talk about this imbalance then, since it's a major problem. Are we all born with the right balance, and then because of certain lifestyle habits, we might develop an imbalance?
We are born... Our bacteria actually come from our parents. So the first time our parents decide to kiss us or hug us, when we're born as babies, that's when their bacteria will cross over to our mouths and we'll be colonized with them. There was a study done in Australia a while ago where they looked at premature babies that were kept in incubators, and they were bacteria free until the parents came along and gave them a good cuddle, and then that's when they got their bacteria source.
So does it just travel like that? I mean, is it like
almost
almost airborne?
It's a new area. It's an area for cultivation.
Okay, but what about kissing then? I mean, are you saying that we can pass on bad bacteria that way as well?
Okay, with kissing, we're assuming that the bacteria is already normal flora for you or for me. So if a person kisses, then they will pass bacteria over, but that doesn't mean that bacteria can then live in the new person's mouth. It has to be susceptible to it, and in general, unless the bacteria are pathogens. So if I've got a cold and I kiss you, then I'll pass over pathogenic bacteria that can live in your mouth. But a normal bacteria in general won't live in your mouth and will die off. Okay.
When we talk about this type of bacteria which breaks down protein, 90%, as you say, of bad breath is a result of protein breakdown by this bacteria.
That's correct.
The protein, what is the source of the protein mainly? Is it from the foods that we eat? So somebody, for example, like the Atkins diet, when you have low carbs, high protein, people have complained of ketosis or bad breath. Is that what we're talking about?
The main protein source is dairy. So dairy, milk, cheese, they're very big factors as far as what we're looking at. The next biggest source is not a food, but it's actually nasal mucus. And then after that, the third biggest source is back to the gum disease. It's any bleeding gums, blood from bleeding gums. Other proteins, then protein shakes become an issue because you usually mix your protein shake with dairy. So it's not mixed with water. But the straight things like protein sources from chickens and meats, they're not in essence going to cause the same problem as dairy is going to cause.
Right, okay. But having said that, with dairies, yogurt is said to contain a lot of good bacteria, and some studies are suggesting as well that the good bacteria in there can actually bring down a particular type of bacteria or compound rather, and therefore bring down the problem of bad breath. And I think the compound is hydrogen sulfide. That's right.
Yeah, hydrogen sulfide is a volatile sulfur gas that smells. Look, yeah, the studies are interesting. Most of the yogurts contain stomach probiotics, so they contain acidophilus and bifidus. So those bacteria live in the stomach. They won't survive in the mouth. Same as mouth bacteria, once they get to the stomach, die off from stomach acid. So it's a different part of the body. The problem with yogurt is not the bacteria, which obviously would sort of bring down hydrogen sulfide. It's the fact that basically it's going to thicken nasal mucus, and it's a protein source. So it's the carrier, I suppose, more so than the bacteria that's in the yogurt. Okay. The bacteria are actually okay.
So people with a nasal problem who tend to get nasal drips, people who suffer from sinuses, should really try and cut down on their dairy products.
Definitely. If you talk to someone who is got a nasal problem and you get them to take dairy completely out of their sort of diet, you'll find within weeks they'll come back and tell you, my problem's not gone, but I can breathe a lot clearer.
Right. So over time, with the sort of diet that we have, and as you say, our parents have introduced bacteria into our mouths, that is how that imbalance started, yeah?
That's correct.
And it can continue to even have a greater disparity, between good and bad bacteria, if, for example, we don't do anything about it, so the bad bacteria continues to grow even more. That's
correct. When you look at lifestyle, it's interesting. It's, okay, protein source, we've talked about that. Acid mouth is another thing that promotes the wrong type of bacteria. The bacteria that cause problems and pathogenic bacteria that cause disease, like to live in an acid mouth, an acid environment. And when you're sitting there having diet drinks, soft drinks, sports drinks, coffee, all of those promote acid mouth. Now, take a nice soft drink that's full of acid, sip it while you're watching your computer for an hour, you've got acid mouth for a full hour, so you're promoting the wrong type of bacteria for that length of time. Same person takes that Diet Coke and say sculls it right down and then drinks a glass of water after to remove it from their mouth, they're not going to have the same problem. So acid mouth is a big factor. And the other factor you've got to look at is dry mouth. Now, dry mouth is basically going to come from alcohol, from smoking, from a lot of prescription medicines. They're all, in other words, you can see it's a lot of lifestyle factors that are going to promote those things: dairy, protein, dry mouth, and acid mouth.
Okay, and you did mention oxygen as well.
That's correct,
right?
Yeah.
Because oxygen is an important component if you want to breed more good bacteria.
That's right.
How do we introduce more oxygen then? Is that oxygen that we breathe in? Is that what we're talking about?
Oxygen in the saliva is the main way that you bring oxygen into the mouth, so promoting healthy saliva. Some of the things you can do for promoting healthy saliva is not to dehydrate yourself, so to drink sufficient water so that you stay hydrated. But chewing gum, which you can't have in Singapore, basically promotes saliva. So they're the sorts of things that you want to do.
And that's why people with dry mouth would tend to suffer from bad breath.
That's
because
right.
They have less oxygen as well.
They'll have a less oxygenated saliva. So at our clinic, we actually do test the quality of someone's saliva. So one thing is saliva volume, but then it's saliva quality as well.
Okay. And people with acidic mouth as well, if they drink too much carbonated drinks every day, does that mean that the oxygen levels are also lower, oxygenated saliva?
No, they're just increasing the acid content of their mouth. So basically
it's not a good environment.
Well, most of the nice bacteria like to live at a neutral pH. So you're going to make it more acid. They're not going to want to live down in that environment.
What about smokers then? Is that more acidic as well, the environment?
Not sure if it's acidic. It's definitely dry mouth, right? It's going to starve the mouth of oxygen. It's not actually smoker's breath that causes a problem. In fact, if you did a poll, I'm sure, around the radio station, you'll say that most people aren't offended by smoker's breath, but they are offended by bad breath. Smoker's breath, smoking tends to starve the mouth of oxygen. So again, you're making a hostile environment in the mouth. So the good bacteria, they're very, very fragile. They just don't want to be there.
Okay. Now, a lot of people who have bad breath, do you think that they have it because of gum disease or because of an imbalance of bacteria just on its own? I mean, I know gum disease contributes to the imbalance, but if you're talking about suffering from a real condition like gum disease, do you think they're suffering from this condition and they should be concerned about that, or majority of people actually just suffer from it just because of a normal imbalance?
It's definitely a lifestyle problem. It's definitely multifactorial. It's very difficult to say it's purely gum disease. Gum disease will give people bad taste and give the person the symptoms as if they have bad breath, but not all gum disease cases turn into bad breath. So you can't sort of say that. It's you've got to have a couple of ticks, tick a couple of boxes. You've got to have maybe nasal, maybe you're high in dairy and you've got gum disease, or you smoke and you're high in dairy. It's always multifactorial.
Okay. Now we will take a look at how we're going to actually combat bad breath by taking a look at how we can actually create a proper balance of good bacteria and bad bacteria to prevent bad breath when we return on Body and Soul. Now, today we are with Dr. Dr Speiser, who is a dentist from Australian Breath Clinic in Sydney, Australia, and he specializes in bad breath. If you have a question, now is a good time to call through on 669 11938 as we talk about halitosis and the problem that you might be suffering from, or somebody that you know and you'd like to help. 669 11938 is the number, and we'll come back in just a while on Body and Soul on 938 Live.
It takes more than just an apple a day to keep the doctor away. Shape up with Body and Soul.
938 Live.
Welcome back to Body and Soul on 938 Live. You're with me, Debra De Souza, today, and we're taking a look at bad breath, a common problem, and a lot of people out there are affected by it. Often this is something that we're embarrassed to talk about, to even broach the topic with our dentist. But today we're going to be taking a look at ways in which you can actually help yourself. Now, we are today with Dr. Dr Speiser, who is a dentist from Australian Breath Clinic in Sydney, Australia. He's down in Singapore, and he's specializes in bad breath. Now, we found out a while ago that 90% of bad breath is actually the result of protein breakdown by odor-causing bacteria that live in your mouth, and particularly on your tongue. So if you've heard people telling you to brush your tongue, that is the reason why you should be doing it, because it tends to live in your mouth, in your tongue, at the back of your throat, where the tongue really extends to. Now, if you have a question, here's the number to call. It's 669-11938. Now, when people have bad breath, sometimes they can smell differently in different people.
That's correct.
Is that because there are many different types of bad breath?
Well, yes, they're volatile sulfur compounds. Now, the main compounds are hydrogen sulfide, hydrogen disulfide, and methyl mercaptan. Now, these compounds come from amino acids. So proteins break down to amino acids, which are the building blocks of life, and cysteine and methionine are the main amino acids. So cysteine breaks down to the rotten egg gas smell, and methionine breaks down to the fecal smell. And that's why we get the confusion of bad breath coming from the gut, because sometimes it can smell fecal, but it's actually just the same metabolic pathway as other bacteria happening in the body.
So for most people out there, they do have bad breath. Their breath is likely to smell, as you're saying, like rotten eggs or like feces.
It's gross, isn't it?
It is gross. It is gross, but that is a fact.
That's right.
Majority of people would have breath that smells
That's
that
right.
way.
I'll give you another compound, and I think you can guess what it smells like. Cadaverine.
Oh, okay. So it's a corpse.
That's correct.
Right. So some people actually smell that way. Okay, but that's not so common.
That's very rare, but it's one of them.
669-11938 is the number to call if you have a question. Now, we're going to take this call from Kareen now. Hi, Kareen. Thanks for joining us.
Hello?
Yes.
My question is, my father suffers badly from catarrh, and he's convinced this is the problem of his bad breath. He has really bad breath, and he gets very upset about it. But he doesn't want to take breath fresheners either because it upsets his stomach. So I was wondering if catarrh can cause bad breath, and if it does, what can you do about it?
Well, definitely it causes bad breath because that's a food source. That's postnasal drip. That's what we've been saying all along, that the three main food sources, one, dairy, then nasal mucus, and then bleeding gums. Right. What I'm not sure is, why do breath fresheners cause an upset stomach? Is he swallowing them?
The ones that you suck on, he's ill in other ways as well, and his stomach's not that good, so he doesn't use, for example, chlorets.
Well, all the internal breath fresheners don't work. This thing about cleansing from the inside, chlorophyll and things like that, that's not the bad breath that we're talking about. Most of the breath mints will make the problem worse because they can be high in sugar, or they're basically just masking agents with a strong flavour. So in general, he's better off not using those sorts of things and focusing more on getting rid of that nasal problem.
Right. How can he get rid of the nasal problem? The doctor says it's just something else. He's in Scotland, and he says it's just something, the doctor says it's just something he has to live with.
Well, firstly, is he seeing a specialist or is he seeing a general doctor? Because a specialist will treat this differently. He can be treated for or tested for allergies. So, for example, dust mites or animal furs, things like that might be thickening his nasal mucus if he's having an allergic reaction to them, the environment that he's sleeping in. If he's got rugs on the floor, all those sorts of things. Dairy, definitely, very big problem. We keep on going back to that one. Apart from that, if it's the pollution in the air and things from all the cars, there's not a lot he can do from that point of view.
Okay, so he should definitely try and see a specialist.
Definitely, an ear, nose and throat specialist.
Ear, nose and throat. Okay.
Thanks a lot.
Thank you very much.
Thanks, Karine, for your call. And 669-11938 is the number to call. Now, I want to go through some of the very common breath fresheners, in inverted commas, out there in the market today that people use, and why they don't work well for us. Okay. Now, let's talk about probiotics. First of all, you talked about chlorophyll. Yes, people have this assumption that because the smell comes from our stomach, they take a lot of probiotics, acidophilus, in supplement
That's
form,
right, yes.
and chlorophyll and so on. They don't work?
Well, no, because basically it's not a problem of the stomach. So unless it's got a direct effect on the mouth and the back of the throat, and you were right on target when you said that most of the problem is the back of the tongue, back of the throat, unless it's directly affecting those areas, it's not going to have an effect on bad breath.
Okay. Now, mint, they have a lot of mint products out there that people take to mask it, or even, mint gum. But gum, I guess, would be different because it promotes saliva, and you said that was actually quite good.
With artificial sweeteners. Ones made with xylitol or sorbitol are very good for you. The ones made with sugar, so the old style of gums, they're going to be bad for you.
Why is sugar bad then?
Well, sugar's a food source. It's glucose. It's it's a common food source for growing
So it will
anything.
break down as well into a waste byproduct?
No, it's going to be a food source for bacteria. So
right.
The bacteria, they're happy to see it.
So they'll proliferate because
that's right. In fact, xylitol is a very interesting sweetener because it's only used in a few products, more in the health food stores. But the bacteria haven't got a handle on xylitol yet, so they think that they can digest it. They actually can't. They digest it and they die off. So xylitol has an antibacterial effect.
Okay. Now, mouthwash?
Mouthwash, look, if you don't have a chronic problem, you don't need any mouthwash. Right. Now, the problem with mouthwash is you're taking it to change the bacteria in your mouth. Most commercial mouthwashes have alcohol content in them. A lot of mouthwashes have saccharin in them. Right. And
what does that do? It dries the mouth?
Well, apart from the fact that there's a cancer scare on saccharin, and it leaves aftertaste. Saccharin has an awful aftertaste, and when taste is one of the diagnostic factors for bad breath, and you're, say, chewing a lot of products with saccharin or taking mouthwash with saccharin, you can mistake an aftertaste for a bad breath taste, so you can actually confuse yourself.
Okay. What about sodium lauryl sulfate? I mean, we hear a lot about this foaming agent.
Yeah, a little bit of a scare. A percentage of people are allergic to sodium lauryl sulfate, and sodium lauryl sulfate is a surfactant that causes the foaming in toothpaste, and people like to feel the toothpaste foam. So if you get mouth ulcers very frequently from using toothpaste, or you get a dry mouth after using toothpaste, then it's possible you're allergic to sodium lauryl sulfate. It will be in every commercial toothpaste and most commercial mouthwashes. Those people should use products that are sodium lauryl sulfate free. In the end, though, every toothpaste mouthwash has a surfactant in it, right, regardless whether it's sodium lauryl sulfate, so it'll just be a different version. But allergy-wise, that's the one that's out there that everyone knows about.
All right. And what about things like tea? And apart from yogurt that has been suggested that could possibly help to bring down certain compounds and help you with bad breath, but I know you did say dairy products are not good. What about tea then? Tea's been shown as well in studies.
Tea's actually quite good. Green tea, in fact, I think can release fluoride as well. So tea doesn't seem to be a problem as long as you're not putting milk and sugar into it.
Okay. Right. So now let's get into creating that balance in our mouth, because a lot of us have that imbalance. How do we create a good balance then?
Very limited at the moment, right? I believe you've got to do 3 things to create the balance in your mouth. First of all, you have to remove the bacteria from your mouth and then replace it with a probiotic or good bacteria. Okay.
And when you're talking about probiotic, obviously you're not talking about probiotics that are meant for the stomach, like acidophilus.
No, we're talking about probiotics that specifically live in the mouth and on the tongue surface. So you have to, and you can't just take them because there's no room in the mouth. The mouth is full of bacteria. So in order for them to work, you first must remove the bacteria in the mouth by taking a very strong antibacterial mouthwash. And then immediately after that, you take a dose of good bacteria or probiotic bacteria that are made for the mouth, and they will then colonize the tongue surface or the mouth. If you just took the probiotics, and this is one of the issues I have with acidophilus and bifidus, it's got to be the same thing. If you're not removing bacteria, you can't guarantee that you've got a colonization just by taking these bacteria.
Right, so people have to detox before they actually take
them? They should. So as far as the mouth's concerned, what I believe is that you take a strong antiseptic mouthwash, and I don't recommend any of the ones out there. These are special mouthwashes that you take to remove the bacteria of the mouth. You immediately colonize yourself with a probiotic bacteria that lives on the tongue surface. That's step 1. Step 2 is that you remove the coatings that build up every day in your mouth. So your tongue, your teeth, between the teeth, back of throat, nasal cavity, all those sorts of areas. And you're doing that because the bacteria only live in coatings that are older than 24 hours. Right, so if your coatings are there and they're not 24 hours of age, you don't have an issue. Everyone's had that thing where they haven't cleaned their teeth the next day and they get that furry feeling on their teeth. That is plaque, and plaque is a coating. That coating only causes problems. You only get decay if you don't clean that coating off every day. That's why people that don't floss their teeth get gum disease and also get decay. Sorry to harp on everyone. But basically, clean the coatings, keep the coatings under 24 hours of age. So clean your tongue, scrape your tongue, brush your tongue, clean your teeth, floss between your teeth, use saline nasal sprays if you have catarrh, nasal drip, any of those sorts of issues. That's step 2. And step 3 is lifestyle. Step 3 is avoiding the proteins that cause the problem, avoiding acid mouth, avoiding dry mouth.
Okay. Now, with step 2 in cleaning the mouth then, I mean, is your brush a good tool to use?
Not for the tongue, it's not. The tongue is got a lot of papilla on it. It's got a lot of uneven surfaces. The toothbrush tends to just move the coatings and the bacteria around. What we recommend is you use a special gel. You put it onto a toothbrush. You brush the gel into the tongue surface. Then you use a thing called a tongue cleaner.
They sell a lot of tongue cleaners out there.
Yeah, they've been around for a long time, all sorts, right? Basically, remove the coating by scraping the tongue cleaner down your tongue surface.
How far should we go, really?
If you look at your tongue, stick it out and you have a look in the mirror, you'll see some bumps at the back of the tongue. You only need to go back to there. Past there, you can't get to. Right, past there, if you want to clean that, you've got to go through nasal flushing through the nose. Right, so you only scrape to the back of the tongue surface, and you're doing it gently because you can damage your tongue.
And what happens if you do that? Does it?
It can be permanent. It can be permanent. We get a lot of people emailing us saying their tongue bleeds because they get overzealous. Now, I mean, if you think about it, this coating can be scraped off with your finger or with a hanky. So you only need a light cleaning with the tongue cleaner to clean the coating off. And then what you do is you actually go back and brush another coating of the gel into the tongue surface because, as we said before, the bacteria are anaerobic. They're not living on the surface of the tongue. They're living in the depths of the tongue papilla. So the first cleaning removed the coating on the surface of the tongue, exposing all the bacteria to the second brushing. So the second brushing is vital.
How many times do we have to do this a day?
Healthy people, morning and night. People that may have a problem might want to do some tongue cleaning after they've had lunch, but generally 2 to 3 times.
With the good bacteria that you say that we should try to put into the mouth, this is not probiotics. I mean, it is probiotics, but it's not the probiotics that we use for our intestinal system, like the acidophilus.
Not at all.
What bacteria is this?
This, there's only one at the moment that's been discovered in the world. It's called K12. It was discovered at New Zealand at Otago University. And very interesting, it was discovered actually to prevent sore throats.
Right.
And bad breath treatment was a side effect of that.
People with sore throats tend to have bad breath.
Well, it's another part of bacterial imbalance.
Mm-hmm.
Now, just quickly, the story on that was the professor at Otago University followed some children at Dunedin, at the local Dunedin school, and he found that one or two children never got sick and the rest of the bunch always did. And when he took samples of their saliva and looked at it, the kids that never got sick had a particular bacteria in their mouth called K12. When he went and did all the research on the, sort of around the world on the internet, whatever, he found that that's basically occurring in 2% of the world's population. So 2% of us are very lucky, have K12 as our normal flora and never have problems. They're the ones that never get sick. The other 98%, we got to work for it.
Okay, and so you're saying that, the rest of the world all have bad breath because, they don't have this.
They're all possibly going to have bad breath if they get a number of different issues going at the same time.
And you're saying that bad breath is linked to illnesses then?
Well, yes, it is, because the illnesses will affect saliva. The medicines that you'll take to treat those illnesses, 7 out of 10 prescription medicines have dry mouth as a side effect. In general, you run down, you tend to get issues.
How is this bacteria placed in the mouth then? I mean, is it in a supplement form?
At this stage, it comes as a freeze-dried bacteria, and you just mix it with a bit of water and you rinse with it for a minute and then spit it out.
And it is live bacteria we're talking about, live cultures.
Yeah, live freeze, but it is not genetically modified. This is from the original Dunedin school kids.
Mm-hmm.
It's perfectly safe. You can kill it off with antibiotics if you wanted to. It's the original population just cloned and cloned and cloned and cloned over and over.
And that helps to restore the balance.
That's correct.
Now, we had a call earlier from somebody who wanted to know about dry mouth. Her father suffers, or somebody suffers in a family from kidney problems and therefore requires kidney dialysis. Now, people on kidney dialysis can't drink a lot of water. They're advised not to. And as a result, they've got this dry mouth, bad breath problem.
Yeah. Look, when you start to cross the bounds of dental medical, my recommendation is always medical first. Make sure that the doctor's the one that's making the decisions about any sort of medicines that you're taking. I probably wouldn't recommend live bacteria in anyone who was immune compromised at all, right, without the doctor actually knowing about that, because the last thing you want to do is cause an infection in the body, which is then going to put more of a strain on the kidneys. So it wouldn't be recommended from that point of view.
All right, okay. And just as a final point, of course, also with some of the things that people are using out there, if they already have bad breath, they have dry mouth, they have to remember to avoid products that contain alcohol.
Correct. Avoid alcohol. Have a look if they've got saccharin on it. Saccharin's going to give you that aftertaste. Get mouthwashes that basically have no alcohol, have xylitol in them. But in general, I'd be focusing on cleaning the tongue more so than mouthwash.
What about getting enough water to drink?
Water's great, just don't drink too much. Right, I mean, you can go the other way as well. If you overdrink and you're urinating all the time, you're actually going to dehydrate yourself. So you have something to eat, have a glass of water. You're thirsty, have a glass of water. But in general, 4 to 6, 8 glasses of water a day is fine. All
right. Well, thank you so much for sharing that with us today.
That's all right.
We've been speaking with Dr. Jeffrey Speiser, who is a dentist and a specialist in bad breath from Australian Breath Clinic in Sydney, Australia. And thank you for tuning in to us on Body and Soul on 938 Live.